mean, there were moments where I just was so down, but I just kept reminding myself, if I focus on that, I'm taking away from the opportunity that I have while I'm still here to be with my wife and the people that I love. Just focus on the time that you have with the people that you care about, and don't focus on how bad it feels or where this is going to take you, because you don't control that. You control right now, right here, what you're thinking.
Hi, everyone. I'm Samira, the founder and CEO of Manta. As you know, I also host a podcast. It's called The Patient from Hell. And today I have a very cool guest with us. I have Tim McDonald, who's going to come here and tell you his story. I think you're going to learn a lot of stuff, especially how to advocate for yourself, for things that you intuitively know you need to do, but sometimes it's hard to push for. Tim, welcome to our show.
Well, thank you so much for having me. It's such an honor to be with you. I've seen your podcast and listened to a few episodes, so I'm very honored to be here.
Thank you so much. Tim, why don't we just start with the beginning? What happened? How did you end up entering this world nobody really wants to belong to?
Yeah, it was on Thanksgiving of 2020, so it was during the shutdown for the pandemic, and my wife and I were just enjoying a Thanksgiving dinner, and I just experienced this really bad pain in my right side, and being the guy that I was, I just said, I'll just go on Monday if it's not gone. And each day it got a little bit worse, and my wife kept asking me, are you going to go? And I'm like, I'll just wait until Monday. I'll just wait until Monday. And then Sunday she came down, and I said I made an appointment, because you still need to make appointments back then to go in. And they didn't know what it was. Thought it could have been a kidney stone, but ordered a CT scan just because they weren't sure. And I got that on Monday. And I remember joking with my wife when the urgent care place told me to come in, how quickly I could get there. And I said, well, I live 5 minutes. I can walk in about 5 minutes and be over there. I remember joking with my wife telling me, well, I guess it's not going to be as simple as a prescription. And then I walked in, and you know how most office visits are. You got to tell them your name, sit down, wait for them to call you back, wait in the waiting room. Well, this was like, Mr. McDonald, come on back, and put me right in a room. And that's when I knew something was not going to be good. And then the doctor came in about 5 seconds later with one sheet of paper in his hand and told me those 3 words that everybody dreads to hear: you have cancer.
So you hear those 3 words. What happens? What happens next?
I was actually like a little bit different than most people, because I had about a decade, and I never say this to like tell people like I just was immune to hearing these words. I just am a big believer that, like I've been practicing mindfulness and consciousness and breathing techniques and, for over a decade at this point. And so when I heard it, I was just like, okay, what do we need to do next? That was the first thought that came through my head. And the only thing that I was thinking in the back of my head was, how am I going to tell my wife about this when I walk home? But the doctor was great, because he actually called a GI surgeon that he knew from working in the ER, knowing that I wasn't somebody who went to the doctor all the time, called him, got me in that afternoon to see him to get a colonoscopy and put a stent in. But when I went home, my fears were correct. My wife was devastated, and almost to the point where she couldn't drive me, and worried about if I needed to stay or go right into surgery or something, that she wasn't going to be able to drive the car. So she was already she couldn't come into that appointment with me, but she was outside and calling her friend to see if they could come down, and, both of them could drive down, and one of them drive her car back and get her home. But I was needing to get a COVID test before they did it. So it was 3 days, scheduled 3 days out. So I was actually able to help drive home and get back. But that was kind of the worst part, was telling my wife.
Well, I have so many questions for you. Where should we go? Let's maybe start with what life was like before diagnosis. What did you do? Where did you work? How did you end up being in the mindfulness space? Because yes, I think you're unusual.
Yeah.
Your reaction to those words.
Well, I've been in community management, like online community management, for almost 2 decades now. And I had worked at HuffPost up in New York when Arianna was still there when they launched HuffPost Live. And then I became the director of community for the entire company. And so just being exposed to like her beliefs and what she did, exposed all the employees to it, whether you were open to it or not, you were exposed to it. And I just kind of started embracing it and talking with some of our bloggers who were into it and got to know some of them and had conversations about like what I was doing on my own and how it didn't fit what I had always read about in books. And they were like, no, you don't get it. You're doing it the right way more than most people do. You're just not doing it in a traditional way that most people are taught. So there's nothing wrong with that. Just keep doing what you're doing. And that's kind of how I got exposed to that.
Very cool. Let me maybe ask you one more question before we go back to, cancer world.
Yeah.
What was the one thing you learned during your HuffPost days that really enabled you to get through the cancer experience?
I really think the whole presence of the fact that we can control our own emotions, and I won't fast forward too far, but it really helped me when I had a major surgery too, like get off of pain meds within a few days, where most people are on it for months afterwards, because I just had that sense of my mind is more powerful than my body is.
That's amazing. All right. We should put a pin in that. We should come back to it post surgery conversation.
Yes.
I actually don't think in the hundreds of episodes we've done, I actually don't think we've ever spoken about it. And I like you, a lot of meditation to do pain management specifically. So we should definitely touch on that. All right. We're going to put a pin in that. We're going to come back to that. But let's maybe fast forward a little bit. So you get diagnosed. You are automatically in kind of this, no pun intended, but driver's seat. Telling your wife is really hard. You then end up exploring treatment options that didn't seem to be the obvious choice.
Yeah, well, I did do all the standard stuff. It was all new to me. I didn't have a family history of cancer. I didn't really have any close friends that were impacted by cancer. So this was all like brand new, and it was during COVID. So it was like I didn't have like I could talk to people online, I could talk to people over on the phone, but really it was my wife and I at home, most of the time. And so it was all just brand new to me. And one thing I remember, and, now I laugh at it, but back then it was like, I didn't even know the difference between metastasis and stage 4. Those were like, I'm like, what did both of those mean? And my sister had actually come out to help my wife when I was first diagnosed for a few days. And has a friend who's a nurse. And she's like, no, metastatic means that it's spread to another organ. And stage 4 is basically like once it's spread somewhere else, it becomes stage 4. So they're both interchangeable and the same thing in most cases. So that was my first education. And then it was just like overwhelming, like with all the stuff. So I did, looking at it, I thought it took forever to get into, after I had that colonoscopy and they put a stent in my colon, because he had told my wife that it was almost complete blockage. It probably would have been in a couple weeks, and my system would have shut down after that. Is, just how long I felt like to get in to see an oncologist. It felt like it was forever, but it was only about a week and a half before I got into one. And when I went in, it was just a standard treatment. He put me on like Folfox. I did 2 rounds with him. He asked me after that second one, you're driving about 45 minutes to come see me and get infusions. You're going to be doing this every 2 weeks. Would you like me to refer you to somebody in our system who can get you infusions closer to your house? And I said, well, yeah, that makes sense. And so he referred me to somebody else. She was in the same system, but when she heard I was on Folfox, said, I don't know why he had you on that. You got 3 years to live. I'm just going to give you the best quality of life that I can for the rest of those 3 years while you're on chemo. And I just remember when she told me that, thinking in my head, I didn't say it out loud, but it was so clear in my head. As soon as those words came out of her mouth, the first thought I had in my head was, that's your story, not mine.
Wow.
And I just was like, this is not the oncologist for me. But I did get a couple infusions from her that was full fury. And then I finally got into Moffitt Cancer Center, which is a comprehensive cancer center here in Tampa, generally considered one of the top 10 cancer centers in the US. And I went in to see him. He was like, "Are you looking to just have me advise your oncologist, or do you want to switch your care here?" And I said, "No, I want to switch my care here." And he said, "Okay, well, just do me a favor, make sure that you communicate that with them that you're switching." And I said, "No problem. I got no problem doing that." But then he told my wife, I told him what I was on, the full Fox for a couple infusions and then the full Fury for a couple infusions. And he said, "Well, I'd probably put you on full Fox," but he goes, "You're pretty young overall. You're, outside of the cancer, you're healthy. We have a combination of the two that is full Fox Fury that is much more aggressive, has a much higher success rate, but comes with much more intense side effects." And I just looked at my wife right then and just said, I like shook my head yes, and she shook her head yes. And I said, "Let's do it." And we did that. And I was on that for almost 6 months. But that was like, I remember towards the end of that 6 months, I was telling my wife, like, I don't know how much more of this I can do. Infusions every 2 weeks. I always tell people I have like 11 to 12 bad days. And then I have like 1 to 2 okay days. And then I'm back doing it again. That's what it felt like, honestly, during that time. But then as soon as I started getting some tingling in my fingers, he said, we're taking the oxyplatin out. That's the ox part of all this for if people are listening and don't know. And we're just going to put you on full Fury. And I said, "Okay, great." So my infusions went from about 6.5 hours down to like 2.5 hours without that. And I was on that. But during that first 6 months, I had joined a group, an online colorectal cancer group. And one of the things I learned was about liver transplants. Now, this is going back, 5 years ago. Liver transplants, there was only 14 centers in the US doing them at that time. There was less than about 20 patients who had gotten them because they're very selective in who they choose to get a liver transplant for colorectal cancer. And but I heard about it, and out of all the other treatment options that I had educated myself on and become aware of, it was the only one that I saw that could be a viable option for me to get the cancer out of my liver, outside of just being on chemo and hoping. But everybody at the time, from everything I read,
Yeah.
my team, everybody told me like the chemo is not going to get rid of all your cancer as a stage 4 colorectal cancer person.
Yes.
So it will just prolong your life. It won't cure you. And so I was like, no, I want to be cured. I don't want to just prolong my life. And so I reached out, started pursuing the liver transplant shortly, within those first 6 months. And then it took like another 6 months to actually get to a point, because you need to be on treatment, good, active treatment, and respond well to your treatment in order to qualify to be a potential candidate for a liver transplant.
I have one kind of foundational question before you keep going. The foundational question is, I know you described stage 4 metastasis early in the conversation, but if you are a listener, you're not familiar with colorectal cancer, you seem laser focused on the liver. Was that the only place in the body it had metastasized outside of the colon?
Yes. My colon was almost completely closed off with the tumor, and my liver was covered in tumors. That's why I wasn't like an option for like ablation, resection, any of those things, because my tumors were all over my liver. I mean, I had a PET scan early on, and I always like to say it was like a Christmas tree on Christmas Eve. All the lights, were lit up on it. And for people that aren't familiar with the PET scan, that's what it does. It just lights up where there's active cancer cells on your body.
So Tim, let me just make sure we give our audience a little bit more context, right? So your liver is lighting up like a Christmas tree on Christmas Eve. The colon seems to be, I think the word you used was fully blocked. Did I hear that right?
Well, it was almost fully blocked. That's why they had to put a stent in. I was fortunate enough where I didn't have to get an ostomy bag, but I was able to get a stent. He actually gave me the option when I went in that same afternoon. Do you want a bag or do you want a stent? And I said, well, you're the one who does this all the time. I know nothing about this. What would you do if it was you? And he goes, oh, I'd go for the stent. And I'm like, well, why are you even asking me? Just give me the stent then, And that's what he did. But I will say this just because we were bringing up the stent. After about my second infusion, I had naturally passed the stent when I was going to the bathroom. And I remember calling that first oncologist and asking him if there was something wrong, or did I do anything wrong, or, is this okay? And he goes, no, actually, it's very encouraging that the tumor shrunk enough to allow it to pass. And so a lot of times, in the cancer world, we talk about scanxiety and everything. I never really had that because I kind of had that indication that the chemo was working on me. And so I just believed that and kept that in my head. Like, it's working.
Keep
Just,
going.
you're going to get a good scan. That's how I was.
That's pretty impressive. I work with a lot of, we help thousands and thousands of patients across the country at this point, and I think that's really impressive. I think it's very, I think hope and true positivity are not the same thing. And it sounds like you had kind of passed hope and were in this truly positive mode, which I think it's a hard place to get to. So kudos. I definitely did not get there while I was on chemo, for what it's worth.
No, I always joke around with people that, I don't say this lightly because it did, as I told you, took me over a decade to get to the point where I was at when I was diagnosed. If I had just started it when I was diagnosed, I would not have been the same way. I know it for a fact. I would not have been. And I'm not saying that just because I was this way doesn't mean everything was positive, everything was hopeful. I mean, there were moments where I just was so down, but I just kept reminding myself, if I focus on that, I'm taking away from the opportunity that I have while I'm still here to be with my wife and the people that I love. And so just focus on the time that you have with the people that you care about, and don't focus on how bad it feels or where this is going to take you, because you don't control that. You control right now, right here, what you're thinking. That's all you have control of.
So Tim, I guess I have two things I'd love to unpack with you. One is at the moment of the stent versus the ostomy bag, there's this moment of you effectively deferring the decision to the oncologist, right? And yet there is this, fast forward a couple months, you are finding this treatment option that is relatively uncommon. 20 people in the world, 20 in the US at least, have done it in 14 centers. How do you go from this moment of deferring decision making to effectively taking it over and driving it?
Well, I think that, as soon as I got into this, right after I started my chemo, I started understanding that I was hearing all these people tell me that I had limited time, very small chance of even living 5 years, all this negative stuff, but they're all statistics. They're all facts, as far as statistics go. But then I was in all these groups, online colorectal cancer groups, and I'm meeting people who had lived 5 years, who were stage 4, who were beating it, who, some survivors that were stage 4 that were 10, 15, 20 years into their survivorship. And I'm like, if they can do it, I can do it. That was just where my mind went, and it's hard to explain, but I just was like, they were like the hope part that you were just talking about. They were my inspiration and hope.
I see this across a lot of cancer types, partly in the metastatic setting, right? Almost regardless of whether it's breast or colorectal or lung, it's the presence of a survivor, thriver, someone who has kind of beaten the odds, and access to them tends to be the anchor, right? Where it's almost like I have an example that I can model after, but there is something below that though, right? There is this, you're modeling after it, but there's also this capture of control, for lack of a better word, around driving the treatment decision.
Yeah, I think what really drove this point home to me was, one, a lot of these people didn't just go by the conventional treatment options.
Yes.
They got other treatment options. The second point was, since I had colorectal cancer, I will literally say colorectal cancer was a pain in the ass for me because for those first 6 months, I literally was bleeding. It was painful to go to the bathroom. It was painful even to sit on the couch. I mean, my wife would buy, I can't tell you how many bags of Epsom salt for me just to soak in the tub and give some relief on my butt, And what I went to the ER once and I went to urgent care at my cancer center twice for this. Nobody was able to tell me what it was. My labs were fine. One time they did a CT scan. Everything looks good. I went to see, my daughter had a baby and she had a tear and ended up, everybody wanted to give her a colonoscopy. And that's not what it is. I had a baby. I need this taken care of. She saw a proctologist and said he was amazing. And I said, who was that you saw? And I went to go see him. And before he even looked at my butt, I told him my situation and he goes, Tim, it's probably hemorrhoids and possibly fissures, and which are little tiny cuts. Yeah. And as soon as he told me that, and I got relief like almost instantly when he gave me the injection for my hemorrhoids, like the light bulb went off in my head. I got the best oncology team, I feel like, who I'm seeing, who never once looked at my butt, but that's not their job, right? Their job is to treat my cancer.
Yes.
And I just, at that moment, I was like, oh. And I was just on a news segment locally here in Tampa, and I talked about this. I went from being a player on the team to thinking I needed to be the quarterback of my team. And then I realized I need to become the general manager of my team, and I'm like, this, because you need to decide who you want on the field with you. Who's going to run the plays for you? Who's going to call the plays for you? Yes. Who's going to, run this specialty position that you need? And that is one of the most powerful things that I've learned through this whole thing, is just understanding that it's about getting the right people in the right positions to give you the outcome that you want to have.
I am so, so happy to hear you talk about this. I am so happy to hear you talk about this. The reason I'm so happy is what you are describing is actually not just for colorectal cancer patients. I cannot tell you how many breast cancer patients I have met, personally myself, who have gone through exactly what you are describing. And I quite literally mean like the exact symptom and side effect, right? I'm talking about the specificity of like Epsom salt in the house, the baths, the like washes, the Desitin, the Botox injection, if you really need to explore that. It's actually very, very common across a lot of types of cancers. It's actually a common side effect of a lot of systemic treatment. And what you just described about you going from, I'm a player to a quarterback to a general manager, is the transition I think patients need to make much, much, much faster, usually in their cancer experience. So I really appreciate you talking about that.
Well, and I really feel like, and I see this and I encourage patients all the time in these groups, because I'm still active in a lot of these groups. I always tell people when they're like, well, my oncologist said this, and it's not the best thing for them. I'm not going to tell them it's not the best thing, but I'm going to say, have you gotten a second opinion? And when they say no, I ask them why. And they're like, well, I live in a rural area. They make up all these excuses. And I'm not saying they make them up. They are real to them, right, in that moment. But I tell them, there are financial assistance programs that help you travel. There are ones that give you money to get second opinions. There's all these resources out there. Don't let that be a barrier for you. Get a second, third, and 10th opinion. And this is what my first oncologist told me that I loved. He goes, don't go until you hear what you want to hear. Go until you believe in what you're hearing.
Such a good line. I agree. I very much agree. So in a funny way, I think it's also, and tell me if I'm wrong about this, I think it's also the reason you were able to be positive.
I think it definitely played into that, definitely played into it.
One more question for you. My question for you is men and cancer. Sorry, well, I guess that's a topic area, I suppose, your question. I would love for you to talk about whatever you have learned about the differences between women and men as they're navigating cancer? Because colorectal cancer is not just a male cancer, and it's like unlike prostate or breast, like it's not a completely gendered
No,
cancer.
not at all. But how we process and handle it are two completely different ways. I think that, and we're all individuals. Let me just say that as, first off, because I truly believe that. And I'm not like a sexist guy who thinks that men are superior than women. I'm not like that at all. But what I do feel is that the way that most men and most women process their emotions are different. And, males, especially in the US, have been, basically society for years has taught us how to be the provider, be the strong one, not show emotion. And the thing that this really taught me was really about the power of being vulnerable and opening yourself up and sharing some of your deepest and darkest thoughts with people that you don't even know.
Hmm.
And I think that most men aren't able to do that, but the ones that I've connected with who are seem to be the ones who really thrive with their cancer instead of just succumbing to it.
Hmm. Can you maybe talk a little bit more about being vulnerable with whom? I ask this because there's gradations, right? Being vulnerable with your spouse, being vulnerable with your kids, being vulnerable with your friends, being vulnerable in a support group. They feel like different thresholds almost.
Yeah,
I'd love for you to talk.
I think you're right. I mean, I've back in the early days of social media, I used to say that transparency always casts a shadow. It's not like you're not being completely honest with the world. And I think it's the same way with being vulnerable. It's really something that I mean, my wife knew most of what I was thinking, but I knew her emotional state. And I knew that, like, if I shared some of those deep, dark thoughts with her,
Yes.
she wasn't going to respond well to that. Right. And so thankfully, I found a men's cancer group and talking just with other guys, I just vented in there and expressed what I was feeling and thinking. And, it never failed. There was at least a couple other guys that would say, I know exactly what you mean. I felt the same way. The same thing happened to me. I went through that too. And, I talked to a social worker about this later, and there's actually a clinical term for that called normalization. When you think you're the only one thinking these things and going through these things, and then you find out other people are too, all of a sudden you don't feel like you're this lone wolf. You're now like, you're part of a bigger society, not just yourself. And so that kind of is comforting for most people. And that's what I learned. And that's really where I did it. But I was able to be as vulnerable as I wanted in those settings. My wife was probably the next most vulnerable person. But then, like, when I did my posts on social media and everything, I was pretty open. I was pretty raw about it, but I wasn't like sharing everything, right? I wasn't sharing all the deep, dark thoughts I had. I don't want people like sending, a wellness check over to me because I'm sitting there thinking like dark thoughts about my life. And so you really need to like decide where you want to be vulnerable and how vulnerable you want to be. But I think the basic step is opening up and at least sharing your story and acknowledging it. I think.
I think you're spot on, and I appreciate the kind of almost framework that we've managed to discuss on the show. If you're comfortable, if you're comfortable, and you can be like, nope, not going there. I would fully understand that. But if you're comfortable sharing an example of what you mean by deep dark thought, I would love for you to talk about it because I think the point of normalization is also crucial because a lot of times cancer patients assume deep dark is yours only. And the reality is most of us are thinking some version of it. So,
Yeah, no, I mean, I remember towards the end of that first 6 months of how bad the side effects from the chemo cocktail that I was on. I mean, I remember thinking to myself, like, I just don't know how much more I can take of this. And, if I don't die from the cancer, I don't know if I want to die from the side effects of chemo.
yes.
And maybe what the best thing to do is just stop treatment and just let cancer take its course. Now, I didn't want to do that because I knew like I made a commitment to my wife that I was going to fight with everything I had. And I just had to remind myself in those dark times, like this was a commitment that I made. This is something that, it's really tough. It's not easy, but you know what? If it was easy, everybody would do it. You made the commitment to do something that not many people get to do. Just put the next step in front of the other. Don't worry about where you're going to end up in a week from now or a month from now or a year from now. Just worry about getting through today to get to tomorrow. That's all you need to worry about.
Yeah.
But really, it was, to the point where I was ready to give up and not do any more treatment and just be done. I was ready to give up.
Tim, maybe one more question for you, and I'll use this as one of our wrap ups.
Yeah.
In that moment, right? Deep dark. You want to give up. And for what it's worth, have definitely been there. Ironically, also chemo. Certain types of chemo have that effect, I guess. Anyway, what gets you through? What gets you from deep dark to I can get through today?
Yeah. Really, well, there's two things. One was that commitment that I had made to my wife and my love for her and not wanting to leave her alone. But I think the second thing was just inside, really deep down inside, I had already started like my advocacy work and I knew I wasn't done with that. And I just felt like I wasn't ready to give up because I had more to offer. And I think those two things combined were enough to pull me out of the darkness and bring me into a better place.
Thank you for sharing that. I fully believe that pretty much everybody listening to the show is going to get a lot out of it. Is there anything I haven't asked you that you would like to share?
Well, I think, one of the biggest things for me, I think is, and I was just talking with another liver transplant recipient this morning, and we talked about this. It's really about like for any cancer patient, if you get through this, the survivorship part of it, right? Like, how do you deal with survivorship? And, I swear I've had more mental issues after my transplant and being no evidence of disease than I did before while I was going through treatment. And it brought me to see a therapist for about 9 months. It brought me to talk with a whole bunch of other guys who were survivors and how they dealt with it. It took me basically about 6 months of all these groups that I was involved with, kind of taking a step back. Most people probably didn't notice it too much because I still did every once in a while, but I was really active in there during treatment. Now I was kind of taking a step back and going, I don't have a right to say this. But one person came to me and said, Tim, I don't know if you understand how much of an inspiration you are. I was just recently diagnosed and I read your story about how you went from having 3 years to live, with your liver covered in tumors to getting a transplant and being no evidence of disease. Your story gives me hope. And I'm like, if I'm not all those thoughts I had, that was selfish. That was really selfish of me because there's people out there that you can be helping. You can be doing this. And, today I really look at it and I'm still like a work in progress. I'm not like, 100%, but what I've found is like my advocacy work that I do now in survivorship, the support that I give in these communities are something that is really almost healing for my survivorship. It's not just something that I do out of my heart. It's something that I do for my body and my mind.
I think survivorship is a series of episodes we might need to do. But I appreciate you saying that because I think, once again, I think the normalization that mental health very often hits after you're done with quote unquote active treatment, I think is a reality across a lot of types of cancers. And all of the things we do to grapple with it feel harder in some ways than getting through the gnarly parts of treatment. So I appreciate you sharing that.
Yeah, it's kind of funny because as you were talking there, I just remembered that's like during my treatment, like I saw my oncology team like every 2 weeks, right? Like, and then twice every 2 weeks because I need to get my pump disconnected afterwards. I got to tell you that and I saw my primary doctor and a dermatologist. Those were like the 3 doctors I had. Today I have 10 doctors.
Yes, I believe that.
But that's just a difference between when you're in treatment, you're focused on curing the cancer. Everything else kind of takes a back seat. You don't worry about it. When you're out of treatment and you're in survivorship, the rest of the world comes into play again. Your job, what you're capable of doing, all the side effects that you now have. You need to take care of all this stuff, and nobody cares that you went through everything that you went through for the last year or 2 years or 3 years or 5 years of cancer treatments. Nobody cares about that. They just care about like where you're at today. And I'm like, wait a minute. I went through all this. Give me a break. Why did nobody tell me about what was going to be on the other side of this, And I'm like, wait, where is this?
I think that's exactly right. I also think it's an evolution of you going from player to quarterback to general manager. And
Yep.
I think that transition also happens over the course of time. But Tim, I do want to say thank you so much for being a guest on the show. I appreciate you covering, I think, some really hard topics. So thank you for being so succinct. Thank you for doing what you do for the community. Thank you for being here, going through it with a positivity that I do think is very inspirational. So thank you.
Thank you so much.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Manta Cares Inc. or Manta Cares' sponsors.